Ladies and gentlemen, welcome to another episode of Face to Face. My name is Nicole Kamwendo and I am your host. On this episode, we are having a conversation that is long overdue. And joining me to have this conversation is the lovely Dr. Michelle Nkhalamba.
Yes, but I'm not old.
That's what I was like, should we just go with Dr. Michelle?
Dr. Michelle.
Yeah, let's go with that. Tell us about you. I know you're a clinical psychologist, but tell us a bit more about what you do in this space.
Well, I am a clinical psychologist by profession. I'm a lecturer in psychology for 20 years. Can you believe that? I've graduated
No way.
thousands of students.
No way.
I started off as a philosopher, but then I
Okay.
realized that I'm not going to make any money thinking about issues. So in my fourth year, I decided to do psychology, fell in love with psychology, did my master's in clinical psychology, and then my PhD. And right now, my passion is in psychoeducation,
Okay.
destigmatizing mental health. I do a lot of individual counseling
Okay.
and workshops. I'm also very passionate about self care, mindfulness, because that's a big part of mental health. So as we go along, you'll learn to know about the benefits of coloring.
Okay.
Can you believe that?
Okay.
On your
It's very
brain.
therapeutic. But we'll
Also,
digress. We'll get into that conversation.
we'll get into
Uh-huh.
that. I'm also what they call a trauma informed psychologist.
Okay.
Uh,
That's a new
be-
term.
because trauma is experienced by a lot of people in life. So I approach my work with that understanding that has experienced trauma,
Yeah.
and then my work is informed by that.
Okay.
So in addition to that, I'm an avid hiker.
All right.
I
I can
like
tell you look very fit.
Thank you.
Very fit.
For a 70-year-old, thank you. I'm kidding. I've just turned 44 yesterday, actually. I'm an avid hiker and I like trees. I like the environment. So that's a little bit about myself.
You like life.
I like life.
That sounds like you like life.
I'm a nerd. I don't know if you can tell. So my part of engaging with the outside world is the hiking part, but I'm mostly reading and in my own space.
Okay.
Yeah.
I like that. Sounds like your life is very serene, one would think.
I try to make it serene.
So the conversation that we're having today is men's mental health, and I'm glad we have you to have this conversation because, like you said, you work in trauma informed psychology and you've been doing this for 20 years. So I think you are probably the best person to have this conversation with because you've seen it in all different shapes and forms. So maybe let's start with how much of a problem is men's mental health in Malawi?
It is a huge problem. If you look at the statistics that come out of police reports in the newspapers, there's a high number of men self harming.
Yeah.
And the problem is exacerbated because, firstly, we have a stigma surrounding mental health in general, but specifically men's mental health. Men cannot freely talk about mental health. Why? Because there are these masculinity norms, or I would say cultural narratives about how a man should behave with their emotions. You remember when we were young, there was a Chichewa phrase, "Mamuna salira."
Yes.
Men don't
It's
cry.
still a thing now.
It is.
It's still a thing.
It is. And that makes it difficult for men just to acknowledge even that they have those emotions. So they can't even talk about what they're struggling with. So other norms include that a man is a sole provider, which is true to a certain extent, but now times have changed. Women can earn. So if a man has that narrative that a man is a provider, if at some point they can't be able to provide for the family, for example, or if the partner out earns them, they become
That's actually
distressed.
a thing, yes.
It
Because
is a
we have
thing.
seen cases, I think I do know of quite a few people who feel that men get intimidated when they are no longer performing that function of a provider.
Exactly. So it causes a lot of men distress. There's a discrepancy between what they believe
Yeah.
to be masculine and, the reality. So if you're struggling, you want to be able to express that. And the other thing is also the way men perceive emotions.
Yes. It's a very feminine thing.
it's a feminine thing. Being vulnerable is not
That's
masculine.
nice, Menezo.
Exactly. As opposed to women, if I have an issue, I'm going to talk to my friends,
For
I'm
two
going to
hours on the phone.
rant, I'm going to cry,
Yes.
I'm going to release, and then I find a solution. But for men, it's quite difficult to express their emotions to their friends because they don't want to, feel or seem vulnerable. And the other thing is just a lack of space
Okay.
to talk about these things, because you need a space where you feel you can trust someone, where you have confidence in the person that you're talking to, where you will feel understood. We
So when
don't
you say
have those
space, do you mean
spaces.
like physical space, or this is more of an emotional space that we're
I
looking
would
at?
say both. Because would you go to a hospital? Would you
Yeah.
go to a clinic? We don't have a lot of psychologists and therapists in Malawi. The few that we have, sometimes it's difficult to access them. I do my counseling, and I have my client list snowballs. They have to hear
Is
that, oh,
it
Dr. Michelle offers this. So it's also that lack of
awareness?
awareness. Where can I go? Who can I talk to? So it is a huge problem. And luckily, we are opening up this conversation because these conversations don't exist as well. But there are a lot of men suffering with psychological distress. They are unheard, they're unseen, they're not even supported, they're not acknowledged. So a lot of men are really suffering in silence. It is a big problem.
Some would say, you and I being females, having this conversation about men and about a male problem, some might find it a bit jarring. Do you think as women we are in a position to talk about this?
Every human being is in a position to talk about the human condition. And for me, I'm here in my capacity as a professional psychologist. So my views are informed by my education. I've got a master's in clinical psychology and a PhD in clinical psychology, and my years of experience.
And vast, vast years of experience.
But also, I work with clients from different backgrounds. I work with females, I work with males from all over the globe. I read a lot. So I appreciate that people have different perspectives and
Yes.
opinions on this matter. And as you're rightly putting it, the lived experience of men is needed in this space. But I come here from that perspective where I really have that professional backing, a lot of research on men's mental health. So
No, we had to address the elephant in the room because I
yes,
know somebody
why are they
somebody
talking
watching
about
me and
men?
like, there are women talking about men in this. Where are the men?
Actually, if it comforts them, a lot of gynecologists are men.
That is true.
Exactly.
I found that very uncomfortable when I went for my first appointment. I was like, why do you know more about my body than I do?
A lot of gynecologists are male.
But we need to appreciate the professional perspective that you're coming from.
Absolutely.
Speaking of, what would you say is the root cause of the problem in Malawi? Because it is a problem, and you've touched on a few issues to say, being a provider is one of them, not having a space to talk about it. But what would you say is the actual root cause in Malawi?
I'll mention 3 important points, and these come from what we call the models of explaining mental health.
Okay.
So I'll narrow them down to Malawi. But there's what we call the cognitive behavior model.
Okay.
Simply put, your thoughts inform your feelings and your behavior. And if your thoughts are maladaptive or distorted, they can cause mental distress.
Okay.
So, here in Malawi, what I mentioned about the narratives of masculinity, that's the cognitive part of it. There's a whole story about what it is like to be a man. As I mentioned, a man should be a provider, a man should be the head of the family, a man should be this, which is true. But in the face of certain realities, one has to adjust these ideas, otherwise it causes mental distress.
Okay.
The example I gave is very real about earning in a family.
Yes.
If the female is a high earner and there's the man who feels I should be the provider, this can cause them to have low self-esteem if they're holding to this rigid belief that as a man,
I
in
have to
whatever
provide. If
I
I'm not
have
providing,
to
I'm not a man.
provide. and they start looking down on themselves, they start feeling bad about themselves. And that informs their behavior. They start numbing these feelings of insecurity.
Okay.
And when they numb these feelings of insecurity, it creates a spiral.
Okay.
All right. So that's how the cognitive model would explain that cause. Also, there's the socio-cultural perspective, where there's a combination of socio-economic and cultural issues. Take the recent, economic crisis. It's actually global. So there are real issues that poverty, economic disempowerment, lack of jobs, they threaten our survival. They threaten our basic needs, and that causes distress. And this hits men more, because obviously they're the heads of the family.
Traditionally, especially in Malawi, I don't think that's something that's ever going to change anytime soon.
So you cannot provide for a family. You have debt. These are real issues that can cause someone distress. So we're having a lot of that now. We have a lot of unemployed men, some of them who are seeking seasonal labor. For example, now they can't go to ask for, some piecework. So that really causes distress. But most interestingly as well is the humanistic perspective, or the sort of like existential perspective. It's a question of purpose and meaning about someone's existence, someone's life. So, for example, in Malawi, it's a very ever-changing society. We've seen a lot of changes in the past 20, 25 years about people's lifestyles, for example. Most of them artificially inflated lifestyles.
I blame social media, to be honest.
Social media.
I blame social media.
And we also have to acknowledge that in our society, it's an open secret that there's been corruption, and certain people have more money than necessary, and they have lifestyles that are unrealistic,
And
which are flaunted around.
Yeah, and it gives everyone that pressure of
Being a
I need
failure.
to do that.
I'm a failure.
Yeah, if I'm not living that way, then what
If
am
I
I doing?
don't have 3 cars, 1 big car,
A German car.
yes, I'm a failure. So for me, it's also an existential crisis, where people are not showing up as authentic as they should because of these superficial standards of what success is, of what being productive is. I mean, seriously, no person can graduate from university in 2 years. You can afford to build a house.
Yes. I mean, the math is not mathing.
It's not. And a lot of young people and men are under that pressure.
Okay.
And as you've mentioned, the social media, you can now visibly see what you don't have, what someone else has. And it's not really based on a realistic trajectory of success. So for me, that aspect is also very important, that now men lose meaning. Who am I? What is my purpose? Am I a failure? What do I need to do to be more manly? So all those things cause distress. So I've singled out those 3 things because obviously there are other factors.
There's the cognitive,
yes,
there's the socio-economic changes, and the
and
humanistic.
the humanistic, existential, seeking purpose.
And seeking validation also in some way. Do you
Yes.
think that since human beings, we are social beings at the end of it, do you feel that maybe to some extent as women as well, we add to these pressures?
Exactly. There's this theory called the social comparison theory, which is healthy to a certain extent because you either compare yourself upward or downward. So you can compare yourself to someone who's above you to say, I would like to be like that person, sort of like a mentor, or compare yourself downwards and say, well, my life is better because if you look at these people,
We feel
they're
better
worse
when
off.
we make somebody else feel smaller.
Exactly. But it becomes unhealthy if the social comparison is to aspire to be that the other have the things that the other person has without actually understanding how they got there. And then you start looking down on yourself, you start cutting yourself down. So there is that social comparison. And as females, yes, you'd say, okay, so and so um, they went to the lake, they went for this holiday, and then you put
Their husbands are
unnecessary,
buying them cars. Where's my car?
where the money is coming from, you can't explain. So there's that unnecessary pressure because, as you know, for some people, marriage is a status symbol.
Yes,
It's
yes.
not about companionship or social connection. It's about a status. I'm married to so and so. It defines them. It's something that they identify with. So if you have a status symbol, it's something that changes. You always have to keep up. So yeah, men are under a lot of pressure because everyone has got their own, way in which they develop.
Yeah.
If I'm an academic by profession, for example. I didn't get into my job saying, oh, you know what, in 5 years I'm going to be a millionaire. For me, I love teaching, I love knowledge. So you can imagine if you have a partner who's in that profession, you can't expect them to grow as fast as, say, I don't know, a business person
Yeah.
or someone who comes from wealth. So men are under a lot of pressure to demonstrate to their partners that, you know what, I can also provide as much as I can. Pressure to send children to the
Really good
best.
schools. Yeah, that's another thing.
Education is important, we all agree, but sometimes if you can't afford it, you can't afford
It's
it.
become a status thing.
Pressure to drive a certain car, as we mentioned, the
Yeah.
holidays. And you actually do that to
Go for an allowance.
demonstrate, yes, to demonstrate that, this is where we are at a pecking order.
Yes, 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 yes. So, with all of this in mind, how does this pressure, especially the pressure to be the better man, the stronger man, how does it then make it harder for men to ask for help? Because wouldn't that also be a sign of strength, somebody who asks for help? Or is it asking for help making men feel weaker or less accomplished?
You've just hit the nail on the head. So, what I mentioned about having a story that as a man I'm strong, in that story, vulnerability doesn't exist. So,
Aha.
if you're strong, you can't be vulnerable. So, it's one of the what we call cognitive distortions or faulty ways of thinking about oneself, thinking in black or white. I'm either strong or weak, nothing in between. But a lot of strong people have weak moments. A lot of strong people can be vulnerable.
That's
So
what makes people human.
exactly, if you hold that script in your mind, the times that you feel vulnerable, you cannot ask for help. So a lot of men don't ask for help because they don't want to feel vulnerable. A lot of men also don't ask for help because they don't know where to ask for help. Because you want to ask someone who can actually help you, not put you down
Yeah.
or exacerbate your fears, your anxieties. For example, I do appreciate the role of religion in our society, but sometimes religion makes other people feel as if they're being ungrateful. If you're feeling worried or you're feeling bad, you're not being grateful. That's
Because
ingratitude.
you've got so much going well for you. Do you know what
Exactly.
XYZ is doing? They're suffering.
So it's also that fear to be labeled as ungrateful if I talk about my problems because my life looks perfect from the outside. I cannot complain. But also just a lack of self-awareness. Nicole, some people don't understand that they're going through mental distress. They don't have the
Is
vocabulary.
it?
There's
So maybe they are suffering, but they don't know that they're suffering.
they feel the suffering, but they don't know how to explain it. They don't have the vocabulary, what we call
Okay.
lack of emotional awareness, lack of emotional literacy, because we feel a range of emotions. So for someone to say, I'm feeling disappointed, not angry, or I'm feeling sad, I'm feeling frustrated because this happened, a lot of men don't have that awareness.
Okay.
And it's not their fault. As I mentioned, these are not conversations that take place. So if you don't have a word for what you're experiencing, you can't address it. You
Yeah.
don't know the monster inside you. It doesn't have a name. So you can't address it.
Okay.
So that's why there's a lot of emotional distress, a lot of psychological suffering, because there's that lack of that, just the inability to describe or understand what you're going through.
Maybe let's just unpack that a little bit by maybe identifying some of the factors that cause psychological strain, because I think our viewers would appreciate that, because like you've touched on something very important. People just don't know. Men just don't know. They don't have a name. They don't know what to call it. So maybe we can unpack that a little bit. Like what are these factors?
All right, so I'll just touch on about three factors. Three is the magic number for me.
Clearly.
So I think anxiety. We all have a general anxiety about how we appear to others,
Yes.
how others perceive us, because we have our jobs, we have our roles. So if you have that general anxiety to say, okay, if I show up in this way, this is how people will look at me.
Okay.
You're going to keep things inside, and then you're going to be, further strained. Environment. The environment that we're in does not allow that sort of openness, that sort of expression. You're always thinking, how will people take this? As I mentioned, you have to talk to people who understand what you're saying. So if you're in an environment where no one will understand what you're saying, I mean, let's circle back to social media, which I think is a powerful, powerful tool right now.
For good and bad.
Yeah, if you talk about your experience, you have a lot of people, commenting, receiving that. I have read the most disappointing comments on someone who has self-harmed. They would say, "Oh, you know what? There are 1,000 women out there. Why would you harm yourself because of this issue?"
Diluting it down and making it seem like
Exactly. So people would rather keep things to themselves. And the third factor is what I've said, that we have real, socio-economic challenges, real systemic challenges with whether it's the power structures in our society, opportunities, limited opportunities in our society, and just, general lack of support, young men having no other men to mentor them. And it doesn't have to be your
point.
parent or your father, but you also need other men in the society that you can look up to, that who can mentor you. So as I mentioned, if you're surrounded by these artificial or superficial signals of, wealth
what
and
masculinity is
what
supposed to be.
masculinity is, wealth and productivity, it sort of like causes that crisis that I was talking about, that existential crisis, identity crisis, because at some point men have to define themselves with something, but there's that identity crisis. If I'm not driving that car, what sort of man I am? If I don't have a 6-bedroomed house, if I'm not building flats in Namiwawa,
If I don't have 3 businesses, I'm not
if I don't
investing
have three
the current
businesses,
trending thing,
if I'm
investing
not
in the stock exchange.
exactly, if I'm not going to Dubai for holidays, who am I? So it's also that crisis that causes psychological strain. Like, who am I? Am I really worth it to be a man? Sort of thing.
Okay. I like what you mentioned regarding men having mentors, because I think that's where it begins from a young age, having the right kind of people around you, especially the right kind of men around you. Would you say that the previous generation, because they were unaware, because I'd like to think that it wasn't done out of malice. It's not an intentional thing that was done where they just didn't have this conversation. I'd like to believe it truly was ignorance, for lack of a better word. Would you say that it is then this generation's responsibility to be better men, better mentors?
I think so. We should go back to looking at our societies as communities. Yes, there is a benefit in personal growth as an individual, but what I mean by community, the phrase, it takes a village to
Yes.
raise a child.
Yes.
That's how we should look at it. Look out for each other. It shouldn't be just for the family to look out for these young men. I always give an example when I look at these stories of self-harm, that a lot of people judge to say, didn't the family know or the
Yes.
parents know? But oftentimes there are people around this person who noticed things, but they just didn't speak up. So I would say you can be a mentor in that sense. If you've got young people around and you notice something, you can encourage them to speak up. Ask them what's going on. Simple behaviors that you can note, maybe drinking a lot, which is a common numbing behavior in men when they're experiencing emotional distress.
They
You can
tend to
you can question
substance
that.
abuse. Yeah.
And bars and drinking places are where men gather to socialize. This is where you can, talk, check in on each other. And it can be a simple issue for young men, like, I don't know the direction of my career, I don't know what to do next. And if you can, talk to them. So have that, communal spirit, be comfortable to start a conversation, talk to a young man, ask them how they do, check in with
Yeah,
them how
I
they're
think that's
doing.
just a simple question. How are you? Starting from there and having the conversation after that. Do you think it ties into earlier on what you were saying earlier about the three factors that affect psychological strain, that perhaps there is the reason why these conversations aren't really being had as much is the identity crisis of not wanting to seem soft? To talk about emotions, is talking about emotions soft, maybe?
Yes, and it's not only soft. I think it causes what we call cognitive dissonance. It's when you hold two beliefs that are different.
Okay.
So, as I mentioned, you have these beliefs about masculinity that say solve issues on your own, keep things to yourself, keep going, be strong.
Push through.
And then there's the other idea that says ask for help, talk to someone, be vulnerable, cry. So you have these two beliefs, and most men are in a state of cognitive dissonance. They can't speak up, but they're feeling this. So that tension in itself is also something that men struggle with. So it's really, like I said, naming the demon, being able to express, what you're feeling. And this is how we start changing that story to
Yeah.
say it's fine to have moments of vulnerability. It doesn't mean that when you're vulnerable, it's about you as a person. It's not a global explanation to say just because I'm facing a challenge in this aspect, that's everything about me. So it's, looking at those nuances to say, everyone
It's a
has a
vulnerable
challenge.
situation doesn't make you a vulnerable person.
Exactly. It's not about you being weak. There's this situation, as I mentioned, in Malawi, we're having challenges, and elsewhere.
Yeah.
It's happening to everyone where, you've received your salary, and in 5 days you're wondering.
5 minutes.
Yeah.
The moment it goes in, it goes out.
Exactly. So it's not that you're reckless with money. It's not about you as a person. It's just
It's
that
the situation.
it's the situation. So being able to change those stories, and I mean, as men, and I know, it's like, oh, I have to be a provider. I have to. When my wife, when my kids ask for something, you have to say, I don't have money today. I'll have it on Friday, without feeling like you failed.
Yeah, I think that's a good point. Without feeling like you failed is what a lot of men feel. Nobody wants to hear no. And I guess also the pressures that we've said, like society puts all these unnecessary pressures to say you should be able to do this. They're unrealistic expectations. So earlier on as well, you mentioned that finding that space that you feel comfortable sharing your feelings for a man, for a man in that situation, because they don't want somebody to talk about their problems behind their back. I think that's one of the main things I know a lot of people have about talking about their problems is, no, I don't want to be a subject of a conversation later. What would you say are the main barriers to men accessing mental health care in Malawi?
Lack of trust or confidence in anyone, or a structure, or a system. So, as I mentioned, we are very few mental health professionals in Malawi. You want to go to someone who you're confident that they'll
True.
understand what I'm talking about. I'm not going to be judged. I always say that friends and family listen, but they're not professionals. They have their interests at heart. They want you to function because they want to ask you for money at the end of the month. If
That is so true. Ooh,
if you're
black tax?
exactly, if you're saying, I don't feel like going to work anymore, I'm being bullied, then they're going to say, you know what, you go to work, all right, because
Dime is makalira.
yeah. So that's the main barrier. But there are solutions to that, just being proactive, making sure that we're pushing, I think from up there, because mental health in Malawi is generally, you know, it receives minimal resources. So if we could push on more resources on mental health, having more professionals, training more people. I work at University of Malawi, so I would say I'm contributing to that, training,
You are. Thank
psychologists,
you.
and then just push that so that in the coming years we have professionally trained people to listen to everyone, and men, of course.
I think one of the, well, like you've rightly said, it needs to start from the top, because out of the entire health budget that Malawi has, only 1% till date, it's still 1% allocated towards the mental health industry. And what's shocking is the statistics of self-harm and how high the numbers always are when it comes to men being affected or men being victims in this case. So how do we channel that? How do we petition for that change to happen? That it should be as easy as going to the pharmacy to get Panado for a headache. And it should be as easy as that's how it should be when it comes to access to mental health care. Do you think having enough practitioners would help?
I think we should start with the political will.
Okay.
Because we're losing men in their productive ages. So
Yes.
that should be a concern. That should be a concern. It's just because mental health is invisible, as in you wouldn't know what's going on in someone's mind. They're not visibly coughing or sneezing. It's important. So I think
We only realize it when it's too late.
when it happens to someone, we know. So I think there should be the political will and be creative with our interventions. I always say that in Africa and in Malawi, I think traditionally, culturally, we've always been communal,
Okay.
right? We care for each other. Can we use those structures? As I mentioned, I find that religious gatherings, you already have people who are, organized with every denomination. Like I'm Catholic, and we have what we call mipakati. When I go there, as a psychologist, I can see what's happening, that it's a support group.
Yes.
Because we're talking about our week, we're talking
Yes.
about our day. So if we could use similar structures to have professionals train them, how can you recognize distress in young men? How can men empower each other? Emotional literacy, because I know that it's a long way to get to have professionals, let's say in hospitals or clinics. So you utilize our already existing structures, be creative, but at the very least encourage emotional literacy.
Okay.
Have someone who can train people in the basic coping skills that men can use on a day-to-day basis to cope, so that things don't escalate.
Maybe in closing, maybe you could give our viewers some tips on how to recognize some signs. Maybe they could be sitting next to somebody watching this and have seen the signs, but just don't know what it is.
I mean, it's not difficult to spot the signs if you're paying attention.
Okay.
So, Nicole, have you noted that everyone is now glued to their phone? You don't even
It's
listen.
a pandemic.
You go to a restaurant, you're having time to chat, but everyone is glued to their phone. So I think the first thing is to learn to pay attention to people, listen to people, talk to people. So I'll just mention a few things that you can notice. A lot of men do not really express themselves, but they have what we call externalizing behaviors,
Okay.
such as drinking a lot.
Okay.
So you might notice that your friend is drinking more than they used to. Some
Even though
withdraw.
they're financially struggling.
Exactly. They withdraw, they isolate themselves, whether from family and friends, or some can start spending a lot, spending recklessly. So that means that something is distressing them, something is going on.
Okay.
But as you mentioned earlier, just checking in with someone, how are you doing? How have you been? Some people are good at masking their behaviors. They can, create a
A
perception
facade. Just have a
that
whole different personality.
everything is going on well. So just noticing those things that are happening. And also what I mentioned, that having conversations about masculinity, restructuring this conversation about masculinity, about what being a man is about. Look, this is about well-being. It's about you feeling all right. It's about you showing up for your family in the best way that you can. And try to find opportunities for emotional literacy. What I mean is have a space where you can talk about emotions, whether you can read. Right now, information is pretty much everywhere. Get a
Absolutely.
book, ask a professional, because essentially the problem with men who spiral into self-harm, it's a lack of emotional regulation. So emotional regulation means that you understand that you can experience a range of emotions,
Okay.
but you can acknowledge those emotions and regulate them or control them. So, Nicole, a lot of people think that emotions like anger, hate are bad.
Guilt.
Emotions in themselves are not bad. It's how you channel them and
Okay.
regulate and calm yourself down. So, if you could master emotionally regulating yourself, things don't spiral. So
Okay.
it's emotional regulation involves being aware of what you're feeling. All right, you could
Naming the feeling.
naming the feeling. I am angry because someone said this to me.
Yes.
All right, and when you have also to know how to calm yourself down
Okay.
in a healthy way, or
Don't
self-soothe,
smash a wall immediately.
or don't swear. You can just check out or maybe leave the space. Another thing is also knowing what triggers you. We all have triggers
Yes, we do.
because as human beings, we've got experiences that left some wounds. So you have to know that if I'm in this situation, I get triggered. And I'm saying to young people that once in a while, check out of social media for 2 weeks, because that is a place where most of you are triggered, because everyone has an opinion on anything on social media. So do check out for 2 weeks so that you regulate yourself, because that's a place where people feel offended, feel insulted. They are reminded. If someone is saying, "Oh, I'm driving to ShopRite in the car," oh, so you're saying that we're poor.
Exactly. It's like you could just simply say, I like eating bananas. Oh, so you think that pineapples are bad then?
I'm going to a restaurant. Oh, wow, you've got money this month,
So
huh?
you can't just cook at home,
You
huh?
can't just cook at home. If indeed, yes, soya pieces, So you have to learn to master your emotions. Plato, one of the psychologists, philosophers, as I mentioned, I was
You were a
philosopher,
philosopher.
yeah, a fan of
There's a
philosophy.
statue of you somewhere, Dr. Michelle, the philosopher.
Man, know thyself.
Yes.
That's why they say that. Every person, you have to know yourself, understand yourself. So that simply means know how you react to things. I like watching movies, for example, but I know that I can't watch these movies because they trigger me. I don't go there spending the night watching horror movies.
Oh, I
All
love
right,
horror
so
movies.
so that see, unlike me, I wouldn't sleep at night. So that's the part. The message that I'm sending here is that I know a lot of people are going through challenges. If you feel overwhelmed, check out, learn to emotionally regulate, know your triggers, understand how you can avoid them, understand how you can self-soothe, whether it's listening to music, dancing, because oftentimes when you are under a lot of stress, you see things in extreme ways.
Yeah.
as shoulds, musts, as you can make a mountain out of a small thing. So calm yourself down to see things differently, because in self-harm, it's usually an impulsive behavior where you're not really thinking of solution. You can't see a solution. So I would say finding a space to emotionally, regulate yourself, get emotional literacy, talk to someone who understands mental health and psychology, so that you also understand your own psychological makeup and how you respond to things.
Dr. Michelle, thank you so much. This was such a beautiful conversation, really insightful, and I look forward to having more with you.
Thank you, Nicole. I also enjoyed the space. So I'll give you an exam after this. I'm joking.
Goodness.
I'm just used to that because I'm a lecturer.
Let me. Well, ladies and gentlemen, thank you so much for watching and staying with us all the way to the end. And we will see you on the next episode of Face to Face.